Well, I don't have fears, going to a dentist. I've been going, just because I'm missing teeth doesn't mean I didn't take care of my teeth. It's hereditary. When I mentioned that to the prior dentist, and she said, "Oh no, that's not true." I don't like to badmouth any other dentist or anything like that, but I wasn't happy. But it is, my mom had it, and my sister, another sister of mine who's 1 year older, she also had teeth missing. And it's a hereditary thing. And every time that we had girls, there go my tooth. So with the calcium deficiency. Eating is hard, You can't eat. My dog is my best friend at this point, because of the fact that whatever I can't eat, he eats. If you go to a restaurant, you have to pick things that's soft. And even if you try to put them in, the embarrassment, you could be chewing something and they'll fall out on the table. So I'd rather not have them in my mouth and be embarrassed. I go to work, I'd rather have no teeth in my mouth than work with some teenagers and they pop out. That means I would have to be an artist and hide my face in the sand, because I won't be able to see anybody else. That would be embarrassing. When I first walked in and Dr. D came in and we spoke, and I told him my concerns, what problems I was having.
I showed her the x-rays and we discussed options of all-on-4 or an option of overdentures. And we discussed both options, and the patient did qualify for a certain amount through our financial partners, but she chose to go with the overdenture. Placed the implants, she did fantastic. She even called me the next day, so happy that she's not in any pain whatsoever. We basically just delivered her lower overdenture, and she's been ecstatic because now she can eat things like corn on the cob and apples and steak.
Chewing meat, having a steak. I mean, I'm in Texas. If you can't chew a steak, you're in trouble. So having those dentures in, it was love at first sight. Finally, I do have my mouth back.